Thank you so much, Tina, for the introduction, and thanks to the organizers for the invitation to be here this morning. I'm just really delighted. So many of you may be familiar with this image. It's from a decade-old story in the New York Times about a new startup company in the Silicon Valley called 23andMe that was hosting spit parties and offering attendees the chance to learn about their genetic health risks. What I hope to do today is to talk a little bit about sort of the history of those companies, the history of consumer engagement with direct-to-consumer genomic tests, build on the previous talk, also review what we currently know from the literature, published literature about consumer utilization and impacts, and finally to speculate on some future trends. So the key takeaways from my talk today are, there's 4 of them. First of all, that we actually have limited data on the impacts on consumers. And the reason for this is that the major existing studies are about a decade old. And we have little or no kind of publicly available data on recent consumers, which is important given recent uptake. The second is that from what we do know of published studies, there is a fairly consistent kind of picture in terms of what people report as their motivations for testing. But studies have also found kind of few significant group level impacts on health behaviors, and that's the snapshot from available studies. Third, and I think this is important, the study suggests significant physician impact, and kind of collectively, there's a picture of about 1/3 of consumers who report bringing their results to at least one healthcare provider. Many report going to more than one. And finally, that there's sort of an upward, I think I see an upward trajectory, as I'm sure many of you do too here as well, with recent increases in consumer purchasing, and I think this is likely to continue given current trends. So I think the sort of the story of direct-to-consumer genomics has been one that's really kind of captivated both scientists and the public alike, and you can see here a snapshot of media headlines over the past decade. As we've heard a little bit about this morning, this started with the founding of 23andMe and a handful of other companies shortly after the Human Genome Project. Between then and now, there have been a lot of kind of peaks and valleys in this landscape, particularly from the standpoint of regulatory permissions to offer health-related testing. But I think the big picture takeaway over the last decade has been that there's been a decreasing cost of obtaining testing for consumers, increasing market value for companies, and this has led to kind of consistent gains in consumer purchasing. And in fact, the 2019 numbers that came out of MIT Tech Review projected kind of current global sort of the number of consumers that have purchased tests globally, actually at 26 million. This was earlier this year, which is substantial, and projections for the next 24 months could be, well, MIT Tech Review predicted about 100 million customers. So those are quite staggering numbers. And so I think that it's a good time, kind of roughly 10 years later, to think about, well, what do we know from the literature that's been published in scientific journals about impacts on consumers? So my group recently conducted a sort of a rapid review of the literature. This augmented 2 prior reviews, including one meta-analysis that was published about a year ago. Our review focused on studies that examined sort of genetic health risk tests, including what we know about the motivations that people report for testing, as well as health behavior impacts, psychological impacts, as well as kind of trends in medical utilization. We found in our review about 70 total articles, 18 that are new from the past couple of years. These studies reflected a range of very standard methodological approaches, ranging from prospective longitudinal cohort studies to qualitative research similar to the interviews that was presented in the prior talk. But I think one key point I want to make about this literature is that we estimated that about probably 50% of all the studies that have been published have been based on only 3 cohorts, so very few unique cohorts are represented in the literature. These are the 3 up here. First of all, the PGen study, the impact of personal genomics. I'm sure many of you are aware of the Scripps Genomic Health Initiative, which I did a lot of work with that project as well a number of years ago, and the Multiplex Initiative, which actually wasn't technically direct to consumer, but I think did provide a lot of insights. And I think another point to make about these studies, certainly from these cohorts, are that the participants were recruited about a decade ago. So we could kind of safely consider these folks to be early adopters. So what have we learned? The participants in the cohort studies to date are mostly white, of high SES. The motivations tend to be fairly consistently reported across studies. Ancestry is something people are very interested in, learning more about their health. It's very interesting and perhaps has been surprising to our research community that people often say, I'm just curious, I just want to learn more. For people who don't know a lot about their family health history, that's a motivator as well. There have been very few studies on differences in motivations and outcomes as a function of demographic diversity, probably because the cohorts have not been that diverse. There was one study of the PGen cohort published a couple of years ago that found few differences in motivation as a function of race, but those groups were very small. So what about health behavior changes? So, again, I think when there's a very studies have reported different things, but when asked directly in these studies, about 1/4 of people will self-report any health behavior change. The most common things people look at are exercise, diet, smoking behaviors, vitamins, or medication use. But I think critically, when studies use kind of objective measures or validated psychometric instruments, they find few or no changes in health behaviors. And moreover, in studies where changes have been observed, it's been difficult to ascertain, sort of the size of the effects. In cases where positive changes are reported, are these maintained? Are they appropriate for the individual as well? So psychological impacts, I think this has been a really critically important thing for studies to look at. Critics have, of course, raised concern from the get-go for, the extent to which this information may prompt adverse psychological responses such as anxiety and depression. And what I want to say here is that there's currently little evidence for statistically significant adverse psychological changes among the groups, as a function of group level differences in existing studies. But I think importantly, although the percentages of people with adverse responses appears low from this literature, the consequences when it does happen may be significant. We hear about kind of personal stories quite often. And so I think it's critically important for us to think through, as many people have, many of you have, how to make resources available to address these things when they do emerge. And so physician sharing in the healthcare system, this is I think, a topic of great interest. From the studies that have been published, the estimates about 1/3 of people who have been studied share their results, as I mentioned, with at least one healthcare provider. It's very often the primary care physician. People have tried to look at, well, what are the characteristics of people who are more likely to take these results to a physician? Those studies have been, I would say, fairly inconsistent. The outcomes of sharing also vary widely. I think, it does vary widely, but in general, I would say it's more common for providers to engage in kind of reassuring people versus actually engaging in change of management. And so I think another important thing here is that consumers express, when people are asked about this, belief in their, kind of their right to access this information without a physician. But also, interestingly, that physicians should be available and able to provide counsel for these tests, obviously tests that they did not order. And very few studies have looked at kind of the similar sorts of outcomes with data that people obtain from third-party interpretation, but from the limited studies that have been done, it's a fairly similar picture. So future trends. So we've talked a little bit about this. This is a graph from MIT Tech Review just earlier this year. And the estimate here is that at the start of 2019, 26 million consumers have been tested by the 4 leading companies. And as I mentioned earlier, this particular source estimated that within the next 24 months, we could see, these are global statistics, I believe, that upwards of 100 million people could be tested, which is just quite staggering in my view. So what do we think about this? What might we achieve this? And I don't know if we'll get to 100 million in 24 months, but I do think that this upward trajectory will continue. Why? Companies are engaging in aggressive marketing, in targeted marketing. I think in kind of learning what works in terms of marketing these tests to the public. And so I think the key implication here is that advertising coupled with low cost of the tests will drive purchasing until market saturation, and it's very hard to predict when that will be. And so I think another kind of important implication here is that I think that so this is the kind of a standard Rogers curve of early adoption, diffusion of innovations and how consumers adopt new technologies. And I think we've moved from kind of the early adopter phase to the early majority phase. And what's important, this theory posits that consumers in these different blocks have different characteristics. Later adopters tend to be more conservative, than early adopters, for example. But I think the key implication here is that the existing studies that have been done may not really accurately inform utilization and impacts, importantly, on current consumers, on consumers that have purchased in the last couple of years. So I think that this suggests a need for new studies. I think it suggests a need for new approaches. We've learned a lot from sort of the prospective longitudinal cohort studies, but they take a long time, and I think this is a space where we need to think about methods that can teach us about these things kind of in closer to real time, for example, using social media strategies and so forth. And I think this is also happening against the backdrop of a broad and shifting consumer health landscape. In the last several decades, we've seen increasing expectations of patient autonomy generally. In the last few years, we've seen increased availability in general of a wide variety of direct-to-consumer health products, from kind of orthodontics to hearing aids to genetics to heart rate monitors and others. And in addition, I think kind of a broader societal trend that we're seeing is changing ideas about what it means to be an expert and the extent to which kind of people need expert knowledge, right? So I think the key implication here is that consumers will increasingly seek sort of after-the-fact physician guidance regarding genomic and other health tests that are purchased direct to consumer. So I'll just end with takeaways and some recommendations or some thoughts, really. Again, that we have limited data. We need studies of recent consumers that leverage new approaches. I think studies that assess, in particular, the influence of demographic factors, taking into account the demographics of recent consumers, as well as the impact of emerging issues. We heard a little bit about this in the prior talk, but kind of getting into issues of how people are thinking about the use of consumer data in law enforcement and other sorts of issues. Second, as I mentioned, from the studies that have been done, we see consistent motivations and few significant group-level health behavior impacts, but this should be monitored for later stage adopters. And I think, in particular, for psychological impacts, continuing to think about how to make resources available when adverse impacts do occur. And to think carefully about the impact on physicians as well. So I did some sort of back-of-the-envelope calculations based on the extent to which people are reporting sharing with physicians, kind of cross-referencing that with current numbers of consumer purchasing. It suggests that we might see, right now around over 3 million instances of sharing with a physician. Those are broad numbers, and I think that it's it's kind of been interesting for me to think about how this is juxtaposed with only 850,000 practicing physicians in the United States. It suggests that this really is kind of an accelerating phenomenon from the standpoint of physicians. I think it would be useful to learn about this phenomenon, how it occurs kind of in the trenches between physicians and their patients, develop and teach ways for physicians and patients to approach these interactions, particularly in kind of the shifting healthcare landscape that I mentioned, and think of this as an opportunity to engage people. And finally, just reflecting further on this upward trajectory, as we've heard earlier today, more people, it's estimated now, have been tested outside versus inside the medical model. And I think that, as I mentioned, this is part of a broader trend of consumer interest in direct-to-consumer health products and devices, and is likely to continue. Thank you.